Prop 23 is about kidney dialysis clinics and was put on the ballot by people who collected more than 300,000 signatures from registered voters in California. And it asked voters, do you want to add state regulations to dialysis clinics? So patients who have kidneys that don't function well enough to survive either need a kidney transplant or dialysis. Dialysis replicates kidney function and takes 4 hours per treatment 3 times a week. About 80,000 Californians receive dialysis at one of 58 dialysis clinics in the state, and 2 private clinics, DaVita and Fresenius Medical Care, own 72% of all the clinics in the state and earn about $3 billion each year. Payments for dialysis can be made by government insurance like Medicare, private insurance, or private funds. Most patients are covered by Medicare, which pays clinics based on the average cost for each treatment, limiting the profit margins. Each private health insurance company individually negotiates the rates, on average paying multiple times more than the government-funded programs like Medicare. Each patient must be visited by his or her physician at the clinic once a month according to federal law. This same law requires each clinic to employ a medical director at 1/4 time. This allows one physician to rotate as a medical director at multiple clinics. So Prop 23 proposes to add several requirements on dialysis clinics as follows. A licensed physician must be on site during all hours that patients are being treated, except when there's a shortage of physicians, in which case a nurse practitioner or a physician's assistant must be on site. Data on dialysis-related infections must be reported to state and federal health departments. Approval from the state is required to close or reduce services, and patients may not be discriminated against based on the source of the payment for their care. The estimated fiscal effects are an increase to state and local governments in the low tens of millions of dollars annually. So in summary, a yes vote means you want to increase the regulation of chronic dialysis clinics, and a no vote means you don't want these changes made. Support for Prop 23 totals $6.2 million, and it's from the SEIU. People who support 23 say clinics collect billions of dollars in fees from private insurance, and they also say federal sanitary standards are not being met at the clinics. People against Prop 23 have collected $93 million from DaVita, Fresenius, U.S. Renal Care, and Dialysis Clinic Incorporated. People who oppose 23 say that this would make the physician shortage worse, and they also say they're already under federal regulations, so there's no need to add state regulations.